Hello, Mark.
Hello,
Welcome.
Cándido.
Given your experience in the redesigning of healthcare system in other countries similar like Spain, what is your opinion about the possibility to increase the efficiency of the system in Spain?
I think broadly speaking, in the 60 countries that I've worked in the last 6 years, Spain is a health service of which it can be proud. It spends just 9.6% of its GDP on healthcare. Its average life expectancy is 81 or 82 years of age. And many people, including the Spanish people, think very highly of the health system that's been developed over many years in Spain. That said, of course, like many countries in Europe especially, there have been financial pressures associated with the global financial crisis and the resultant Eurozone crisis. Spain has normally tried to deal with these pressures through three principal mechanisms: reducing the number of staff, reducing the pay for staff, and reducing the amount paid for drugs and pharmaceutical products. Now, of course, that has proved to be reasonably successful. Spain has reduced its expenditure over the period since the Eurozone financial crisis by some 14 or 15%. And of course, people are concerned, the patients are concerned, the citizens are concerned, and the health workforce is also concerned. I believe it's been difficult but necessary to ensure that Spain remains in the Eurozone and the European Union. But of course now Spain is growing. This year you're looking forward to 3% growth in your GDP. Let's hope better times are here now in Spain, and it's now time to think about the future.
As you said, in Europe there are other healthcare systems similar to Spanish system. Could you summarize our experience in other countries in Europe about the process of transformation of this system?
Yes.
Very close to Spanish?
Of course, Cándido. Now, first of all, the universal healthcare system in Spain is something which Spaniards and many Europeans are proud of. I think Spain delivers high quality care for around the OECD average of 9.6%. But there are different trends now that different countries are starting to develop and accelerate. And as Spain moves from its cost cutting, it needs to think about 5 different trends to transform its health system. The first one is that in any society, an aging population with more long-term conditions means that the model of care needs to change. And what we're seeing now in many health systems is patients becoming partners in care, not just passive recipients of care. We know from work that's been done in the United States of America, for example, where patients become partners in care with the professionals, their consumption of care can reduce by between 8 and 21%. Secondly, the big issue, and we see some of it in Madrid and some of it in Valencia, is the integration of primary, secondary and social healthcare. This trend is happening across the world, and Spain needs to take advantage of its national and universal health system and better integrate care. Thirdly, the adoption of technology is very important. In many countries in Asia and the East, we are now seeing that the mobile telephone is becoming the main portal of healthcare delivery. Even in Israel, for example, some of our clients in Israel, nearly 60% of all consultations now take place on the smartphone. I wonder what that percentage is in Spain. Fourthly, the issue of technology is also important to make sure that we develop better big data and and analytic capability. Normally in any developed society, 1% of the population will drive 30% of the healthcare costs, 3% will drive 50%, and 5% will drive 60% of healthcare costs. Using new techniques in big data and data and analytics, every health system needs to find these people to make sure that they understand where they live, what they do and how they live their lifestyles, and start to promote well-being and good health as opposed to illness and bad health. And finally, the fifth trend that we see now is the development of consolidation in the insurance companies and also consolidation in the hospital sector as well. Now, I know there has been some consolidation in Spain amongst the insurers. I think there will be more of that in the future. And also I think there will be more consolidation potentially in the private sector hospitals and potentially some public sector hospitals as well. These 5 trends I think will play out in Spain over the next 5 to 10 years. And what you need from your politicians is a good, honest, open debate about how Spain will best develop its health system.
A lot of citizens in Europe think that the sustainability of the healthcare system, such as we know in Europe, have to face in several issues. First is efficiency. You have spoken about efficiency, but also other issues like chronicity or introduction of innovation in the healthcare system. Now we are going to speak of the other side of the problem. What type of formulas do you think that are adequate for the Spanish system?
Well,
improve the financing.
No, of course. I released my first book in October of this year, and it's called In Search of the Perfect Health System. And I've worked in 60 countries on nearly 200 occasions in both the developed and the developing worlds. I'm afraid to say there is no such thing as a perfect health system, but we can look at certain parts of health systems in certain countries to make every health system and health service better. Now, I think for Spain at the moment, given the efficiency and cost-cutting agenda that's been with you for the last 5-7 years, of course, it's important to try and transform your health service. So the 4 or 5 issues that I identified would be the 4 or 5 issues that I think Spain has to take more seriously in the future. Patients as partners, integrated care, big data and data analytics, looking really at the issues of transparency and so on and so forth. There isn't a magic bullet in terms of making health systems better. In Spain, roughly 70% of your healthcare is provided by the public sector, 30% is provided by the private sector. I know this is a big political and ideological debate in Spain. I think increasingly around the world it's becoming less important who provides care. It's much more important who is agile and able to innovate, which frankly means higher quality care at the same or less cost. What we are seeing in other countries, which may happen in Spain, is the introduction of the telecommunication companies and the retail pharmacies providing more care as emergency rooms become more crowded, as waiting lists extend. Now, I'm not sure of the extent of those developments in this country, Spain, but I know around the world the rise of other industrial sectors playing their part in healthcare is almost an unstoppable force.